Welcome back to The Line. We learned as we were taping this week that New Mexico Department of Health Cabinet Secretary Retta Ward died on Thursday morning. We extend our condolences to her family and colleagues. We had already planned to discuss school-based health clinics this week before we learned of her passing. Those clinics across New Mexico are facing funding cuts. The State Department of Health is expected to cut at least $300,000 of funding for the program, and according to local media reports, school-based health centers provide many services, including primary care and behavioral health services to students who might otherwise not be able to access medical care in rural areas or neighborhoods where there aren't many providers. DOH is currently looking to cut over $11 million across the department, but the final decision, Sophie, about cuts has not yet been made. But let me ask you this straight away. $300,000 does not sound like a lot of money in this world or in this state, even with a budget crunch.
Certainly, yeah.
However, is it not about priorities? Do you not get a good bang for your buck for $300,000 as opposed to cutting $300,000?
I certainly think you do.
else?
I mean, when you think of the emphasis that our schools place on keeping kids in school, you know, a kid who's unwell, who has potentially, as we've heard in some of the news reports, significant issues going on at home that these clinics can help to identify and address. Not having to spend a day out of school, several days out of school, instead being taken care of right there. I think that's a tremendous value. $300,000 feels like not very much. Now, the problem, of course, is if we don't cut $300,000 here, where does it get cut? And there are so many competing interests. But looking at this one, this feels like an important program to me and something that I would hope that the state would find a way to maintain.
Antoinette, your thoughts on this one especially? You work in similar fields. Do you know what I mean? So any kind of budget cut is a problem, and a lot of these folks are relying on this money. The predictions are it just won't happen unless this money comes.
I think this is just such a close to the bone cut, and it is so disturbing. The contrast, though, with the employee health care plan just really reveals the lack of coordination, because they're two completely different entities dealing with this money. Here's the school board dealing with what's best for their employees, and then we have the kids suffering. So making the comparison is kind of tough, but they're different entities dealing with different budgets. I would hope that maybe they could find some money by collaborating somewhere.
Right, and a lot of this money is contingent on us spending money to get the federal match, and if we don't spend it, we don't get the federal match, so it all becomes one big circle.
Exactly.
And Antoinette, is the problem here partly this idea of mental health issues and help for kids? We can't seem to get our arms around the idea of mental health and the reason this is important. Do you know what I mean?
I think that that's exactly right, because so many of these children's issues are identified in the clinic. And so if we can get the identification of the problems at home or the identification of the mental health issues early, we can address them before they become really expensive problems.
That's how we can pay now or pay later, Dan Foley, as the old commercial said, you know.
Well, it depends. Gene, you're a pay now all the time.
I'm paying now all the time for sure.
So at some point, like Sophie said, we got to make a decision. Listen, I haven't been a strong advocate of the school-based health clinics even when I was in the legislature.
Why not?
Because I think we have plenty of nonprofits and entities in this state that were and are doing a good job at this.
I'm going to emphasis on the word plenty. I mean, there are some, but
there's some
And
really
were.
good ones.
Yeah.
There are some really good ones still here in New Mexico. And I think if the schools and the state embrace them to have a collaborative partnership to do that, I'm just telling you, Gene, I have a problem as a parent that if my kid's falling asleep in class, that some teacher can send my kid somewhere to make some diagnosis of that kid, and there's no communication. It doesn't come back to the parents. And that's kind of the frustration that a lot of folks have with the school-based health clinics. They're taking a lot of these roles of the family and the parent out, and they're just automatically acquiescing that to someone that gets to make a decision.
You're not suggesting that we do without this program because the other way is better.
I'm telling you that I think we could do with a program that works with some of the very successful nonprofits in New Mexico that are better positioned to do this than going to the school board and saying, let's have this first line of defense being teachers in the classroom.
Hang on, time out. How could a nonprofit that's 2 miles from a school be better positioned for a kid than inside that kid's own school?
And that's desperately underfunded as well.
Right, you know.
So
The school is the perfect
Do you want me to
place
answer
for
your
this.
question?
I do,
You
but I
wanna
want to
ask
set it up for
multiple
you.
questions. No, you don't,
The
you don't need to
school
set
is the
question. I got
absolute
it.
perfect place,
It's not the
Dan.
perfect place. The school is the perfect place to educate a child, Gene. That's the problem with our schools in the state.
Mm-hmm.
We're not educating kids in school anymore. We're feeding them, we're training them, we're doing school-based health assessments. On top of that, we're throwing in 8,000 hours of testing. We've taken the educational component out of the schools. Now, Gene, if you're advocating that,
Mm-hmm. I think we're on a red herring trail here. We're going to get Eddie in here in a quick sec. But Dan, I'll come back to you.
Sure.
I'd like to know what would be a better solution to you.
I think I've
than-
clearly articulated that.
Eddie Aragon, is this right to do this? $300,000, not a lot of money in this world.
I believe I'm pretty qualified to answer this question from the standpoint that my wife's the pediatric hospitalist over at the University of New Mexico Hospital.
Ah, good deal.
And what those schools alleviate for the hospital is this inundation of all these patients and parents who don't know what to do. So they line up at the front door of the urgent care clinic and you see 10, 12, 14-hour people lining up when you have a nurse who can just adequately address and say, hey, you know, the sky isn't falling, your kid's going to be okay, why don't you go home and prevent your child from getting all the others sick. Most recently, a big bronchiolitis outbreak, not talked about on the news.
That's right.
But many of these schools, including the private school which my children go to, say your child needs to stay home. Why do they know this? Well, because they tap into nurses and people who are actually on campus. And then
Are you comfortable with mental health help in a school for a child? Is that the appropriate place to have this happen?
So I wouldn't be able to kind of speak to that because I don't know enough about it, but I am not on the surface of it comfortable. What I am comfortable with is the fact that they can address kind of just level one, you know, typical type things inside the school, and I think that's enough. But the more in-depth, you know, analysis, I know there's like 24 that are waiting over at Albuquerque High School. You know, that
Meaning there's a waiting line now. from
obviously that
previous
takes
cuts.
a
Yeah.
long time to go ahead and evaluate a mental.
That's right. And Antoinette, that brings me right back where Eddie left off. There's assessments in this world that can be done to help other professionals make decisions for those kids and those families. Why not in the school, ground zero, where those things show up and people can have an eye to look at these things?
That's exactly right, because parents don't always know what's going on, and if they can get the assistance where they can get it. And so many parents don't have access to these kinds of resources. I
Right.
mean, maybe you do, and you're able to do this, but so many parents don't.
Let me finish with Dan. I said fairly I would give you the last word on this if you would. I just would, again, like to know, what is the problem with a school-based program? I really don't
think
understand.
at the end of the day-
Let me ask you this. In the article, in the journal article we all read this week, there was an anecdote about a child who had been kicked in the head by his father. It was complaining about headaches and had gone to the school nurse. And clearly you need an intervention of some sort at that point. Why not at that very moment in school? Why does a kid who's been kicked in the head need to make an appointment for some place 3 miles down the road?
Someplace 3 miles down the road. Gene, see, you like to blend all these things and make it sound like it's all rainbows and unicorns. The kid tells the nurse he got kicked in the head by the father. That's an immediate contact to the police department. That's child abuse.
sure it
That's
happened.
the way that works.
I'm sure it happened.
And so we have grown from the school nursing program where nurses were able to do what Eddie was talking about. Your kid's sick, call the parents, send the child home, come get your kid, to now we've morphed into this giant school-based clinic that kids are being treated without parents being contacted, being included in the process because they've grown that program. And that's the problem I have, Gene. No one's advocating that we take school nurses out of the program. No one's advocating that we don't give kids an opportunity if they're sick to their stomach to go see someone. We are now taking time out of the school, budgets out of the school, to add another level of bureaucracy. And the most important part for the viewers to realize, Gene, all of this work on these children are being done and being done legally without any information being passed to the parents. That's a huge problem.
Up next, we talk about updates in the ongoing debate over the Albuquerque Rapid Transit proposal.